So today is March 1st, and I'm standing here beside Miss Kristin Gordner from the United States while she's having some therapy. Uh, Kristin, can you tell us when did you have your surgery and what kind of surgery did you have?
I had my surgery exactly a week ago, and I had an artificial disc replacement in L5S1 with the M6L with Dr. Bierstedt.
Right, and why did you choose to come to Germany, and why did you choose to see Dr. Bierstedt for this replacement surgery?
Well, his name is one that always comes up when you start asking questions, and I had learned about this particular disc about 10 years ago. So I saved up for 10 years and was trying to find the best doctor in the world, and I think I found him because I have incredible results.
Now, what kind of surgery was offered to you in the United States?
They want to do a triple level fusion of the lumbar spine, which would basically mean I would have no movement in my low back at all.
And have you always been physically active yourself? And how much were you limited because of your disc disease?
I originally was injured 25 years ago, so that's my body stopped moving well then, and I lost the use of my leg and my foot for about most of the use of my leg and my foot in my last surgery, which was 10 years ago.
You're 1 week after surgery.
Oh yeah.
You know, do you already feel a difference in regards to your symptoms comparing your post-surgical outcome and preoperative?
Absolutely. I came in here 2 months ago. I was on 2 canes and I had a carbon fiber brace on my right leg from the knee down that was immobile. And yesterday I was tipping around on my tiptoes and I bent to pick up a box for the first time in 25 years, just really something light. I dropped off the floor. It's unbelievable. I actually have no pain except for a little bit where the incision is. It just feels like stitches. And that's it. I have no pain.
That's so great to hear. I mean, from a person who obviously knew what pain was actually
it's
feeling
been
like.
25 years. I'm to tell you the truth, it's shocking. I'm shocked. I woke up and I had no pain after surgery. Who does that happen to? It's great.
That's great. Now you are obviously under the treatment of this gentleman with his good hands.
Yes,
he is.
excellent hands.
He's one of the therapists at the medical center. How do you find it that you had surgery and then, as an kind of included part of the package, a post-surgical rehabilitation at Medicos?
This is really great because it's really important. At least where I come from, you would only have one person in charge of your occupational therapy, and your lymph drainage and your physical therapy would tend to be the same person, and they might not be well-rounded in all of those 3 areas. Whereas here you'll have 3 separate therapists who are specialized in those areas. So you will have someone who's just working on how your body moves with occupational therapy, someone who just does lymph drainage, someone who just works on the muscular tension, and they're specialized.
And do you feel that the specialization they render here at this center meets your requirements, your personal demands?
Absolutely, because you get to meet with the nurses and the doctors every day as well, and everyone here speaks really good English, both at the hospital and here at Medicos, and so it's been really easy to get across anything I might be worried about or questions they're asking me. It's been very easy to there's no language barrier. So
Now
yes,
you're
when
post-op. Are you encouraged to go back to an active lifestyle?
I'm worried that I'm going to go back too fast to an active lifestyle. But yes, I can. I mean, I have all these dreams in my head after I'm done with my therapy, all the things that I want to do with my life. I can't thank you guys enough.
Well, it's now your way to go now for an active lifestyle. Would you share your experience with others who process the idea of having motion-preserving disc replacement versus a fusion? Would you encourage people to go for disc replacement?
Oh, of course, because I mean, if you do a 1-level fusion, most of the time, the next level up or the next level down, you're then going to become hypermobile. So then you're going to have a fusion there, and then you're going to have to fusion there. And so why wouldn't you preserve that disc movement and preserve the rest of your discs functioning normally if you have the chance? I mean, it's physics. You have to do that.
Why do you think is it not offered in the United States?
And the vaguest idea. It makes no sense to me, especially since this particular disc that I have in was made in the U.S. I think it's synthesized 20 years ago. The answer is I don't know. It doesn't make any sense. But the fact that it exists and that people are getting to know about it is huge. It's worth every penny. It's worth every penny.
Yeah, return home and be an ambassador for motion preserving intervention and prove everyone wrong who say only fusion is your way to go. People who are restricted in their lifestyle after surgery and likely have another surgeries to face down the road.
Right.
And
Absolutely.
keep in touch with us and let
Thank
us know how things
Thank you.
change in your life.
I will. Thank you so much.
Thank you.